have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. This model of infectious diseases causation is called an epidemiological triad. The first component is the agent. This is the organism that causes the disease. It can be bacteria, viruses, parasites, or fungi. Second is the host, who is the target of the disease. The third component is the environment. This refers to the surroundings and conditions that are external to the host that allows the disease to be transmitted. In addition to these three components, transmission pathways between each of these allow the spread of infection. These transmission pathways can be direct or indirect. In direct transmission, the organism is transmitted directly to the person. This could be through touching, sexual intercourse, coughing, or sneezing. On the other hand, in indirect transmission, the organism is transmitted via an intermediate. There are several ways that this can occur. It can be through contaminated objects such as toys, soiled clothes, or even through food or water. It can also be through an intermediate vector, such as a mosquito or a tick. Now that we know how infectious diseases are transmitted, let's have a look at how to control them. Changing behavior can reduce or eliminate the risk of exposure to an infectious agent and prevent their spread. There are many different and sometimes simple health behaviors that can be adopted, including using condoms to eliminate or reduce the risk of sexually transmitted disease, regular hand washing, having a healthy diet, or using insect repellents. Behavior change is an important target of health promotion programs. Vaccines are one of the biggest successes of public health and have led to reductions and in some instances eradication of infectious diseases. Routine immunization of children has led to a dramatic decline in diseases like measles, diphtheria, and pertussis, saving countless lives. Vaccines not only protect the individuals, but by increasing the level of immunity in the community, also protect others. This is called herd immunity. Medication has been one of the mainstays of managing infectious diseases. Antimicrobial medication work by either killing the microorganisms or inhibiting the replication. They're not only used in treating diseases, but in some situations can also be used to prevent infections before or after being exposed to a disease, pre- and post-exposure prophylaxis. A significant issue in the fight against microorganisms is antimicrobial resistance. This can happen when microorganisms develop resistance to drugs that were once effective against them. Antimicrobial resistance has been accelerated by the inappropriate or excessive use of antimicrobial drugs and has become a significant issue in the fight against microbes. Surveillance is a tool that is used to control infectious diseases. It is used to monitor diseases and their trends, characterize patterns of disease, and detect outbreaks. Surveillance can also guide the prioritization, development, and evaluation of disease control programs. In most countries, there are a number of diseases or conditions that are required to be notified by law. These are called notifiable diseases. Laboratories and doctors routinely send information to health departments who monitor them and act accordingly. Modifying the environment is another way to control infectious diseases. This includes activities like vector control, which is the eradication or control of vectors that can transmit diseases like malaria and dengue, ensuring that there is safe water supply, which leads to a reduction in waterborne diseases like cholera, Cryptosporidium, and hepatitis E, and improving sanitation facilities and hygiene, which can reduce the spread of diseases like Shigella, hepatitis A, and Salmonella. Other environmental measures include improving housing and working conditions, ensuring food safety, and enhancing air quality. Infection control in healthcare facilities is important because infections can spread quite rapidly in these facilities if proper precautions are not taken. Ways to prevent the spread of infection include proper sterilization of equipment, wearing appropriate personal protective equipment, isolating infectious patients, strict hand washing practices, regular cleaning, and having a good hospital surveillance system so that these infections are recognized and managed early. There are various other factors that contribute to the control of infectious diseases. These include broader measures like improving the social determinants of health, such as education and employment, having strong healthcare systems, and having an effective health workforce. Finally, the One Health concept recognizes that human health is closely connected to the health of animals and the environment. Therefore, successful control of infectious diseases requires the cooperation and collaboration of many specialties, including veterinary and environmental sciences. So that's a quick overview of controlling infectious diseases. We've taken a quick look at how infectious diseases are transmitted and
Hello, friends! How are you doing? I'm sure you've heard about the coronavirus. Do you know what it is? Sure you do! Everyone is talking about it! I've looked up information about what we know so far to explain it to you, although there are still many doubts to be solved. COVID-19 is a disease caused by a virus, which belongs to the family of coronavirus. This virus is the one that caused a pandemic in 2020. A pandemic is a new disease that spreads all over the world and affects many people. So far, we have observed that this virus can spread very easily via vectors like objects we have touched, through sneezing or coughing. This can cause many people to get sick during the process of transmission. That's why the disease has spread worldwide. As you know, the important thing now is to look after ourselves and others. That's why many measures have been taken. To avoid the spreading of the virus, it is advisable to follow some hygiene standards. Wash your hands very often or use hydroalcoholic gel. Did you know that this way the material that envelops the virus is broken? If this material is broken, the virus can't infect the cells. Be careful with the objects you touch, and avoid touching your face. Keep a safe distance from others to protect yourself and them. If you use a mask, be careful not to touch it once you've put it on. The mask should cover your mouth and nose. Cough or sneeze into your elbow. Research is very important to be able to solve all our doubts. Moreover, we should thank all those people who are working and helping so that we can get back to normal. Would you like to be a superhero? Follow all prevention measures to protect yourself. If you're not feeling well, let your parents or teachers know. You may have to stay at home to feel better and protect others. If you have doubts or feel nervous, talk to your family or teachers. They can surely help you.
Our topic for today is planets of the solar system. The 8 planets in their increasing order of distance from the Sun are Mercury, Venus, Earth, Mars, Jupiter, Saturn, Uranus, and Neptune. They revolve around the Sun in definite orbits. Mercury is the smallest planet in the solar system. As Mercury is nearest to the Sun, it is extremely hot during the day and extremely cold during the night. The second planet, Venus, is the hottest and brightest of all planets. As it can be seen in the morning and evening, it is called as the morning star or evening star. The third planet in the solar system is our planet Earth. Nearly 70% of the Earth's surface is covered with water, due to which the Earth is also called the blue planet. It is the only planet on which life is known to exist. The fourth planet is Mars. It is also known as the red planet because of the presence of red soil and rocks. The fifth and the largest planet in the solar system is Jupiter. It is so large that it can occupy nearly 1,300 Earths inside it. The sixth planet, that is Saturn, is the second largest planet in the solar system. It is yellowish in color. It has beautiful rings around it that are made up of ice and dust. The seventh planet is Uranus. A thick layer of gas covers this planet. The eighth planet is Neptune. As this planet is farthest from the Sun, cold winds blow here at very high speeds.